Diseases can often be hard to quantify their economic impacts on the industry. But if we look at just a couple of major diseases that we work with here, there's acute hepatopancreatic necrosis disease, which costs the white leg shrimp industry over $1 billion US a year. And then sea lice infection in Atlantic salmon. Recent estimates are that a third of all production costs in the seawater phase in the salmon industry in Norway is caused by the treatment and management of that infestation in the species. But broader than that, diseases in multiple species cause not just welfare effects, but also reduce input-output ratios, and ultimately have an effect on the economic sustainability of the industry and sustainability in general terms. I think that's one of the very cool things about working here, is that our pathogen biobank is quite extensive. We have multiple isolates of even the same pathogen from different regions in the world. For instance, Tenacibaculum maritimum isolate from Western Canada may be quite different from, say, in Norway or Chile. It allows us to be a truly global-facing company and work with companies from around the world. I think one of the big advantages of working with us is that we have such a diverse team with expertise both in cold and warm water species. I think what we have here is something quite unique in that we work with salmonid species, tilapia, shrimp, and also some of the emerging species like sea bass and cobia as well are just some examples of species that we work with. We really try to be as industrially relevant in our disease models as we can be. And obviously we're working in tank-based systems, which really, in general terms, aren't the environment in which those diseases are happening. But we're very conscious of that, and we really try and tweak those experiments based on how our end user is going to be farming or where that technology is going to be applied. So yeah, we work with a wide array of species. We have good networks and being able to bring them into Canada. Our level of certification allows us to work with endemic and non-endemic pathogens. So we can bring in pathogens from around the world. We can bring in vaccines from around the world and so on. And that really puts us in a kind of unique space.